Arkansas, and she's going to talk to us today about suicide prevention and give us an introduction to that. We're happy to have you.
Thank you. Okay, well, I completely forgot that I submitted that, so I had this whole thing in my head of how I was going to introduce myself. Anyway, so I'm with the Arkansas chapter of the American Foundation for Suicide Prevention. The American Foundation for Suicide Prevention's mission is to save lives and bring hope to those affected by suicide. And I want to start today by saying thank you for being here and in this room and choosing this breakout session. By doing that, you're actually helping us in our mission to save lives. I hope today you can maybe learn something new from this presentation and take it back to your communities to educate others about it. One important thing to tell you is I am not a mental health therapist. I am not a mental health expert. I do not know all the answers. So I know that's shocking. But at the end of this presentation, we're going to do a Q&A. And so I may not have the answer, but I have an incredible national organization backing me, and we will find the answer for you, okay? Other things to note for you is that I am an advocate of suicide prevention. I am here today because I have several volunteers across the state who are loss survivors, and I carry their stories with me. So when I go and present, that's who I'm thinking about. The number of parents that I've talked to that have said, we'll do whatever it takes to just make sure that nobody else experiences the loss that we've experienced. I carry that with me. So that's why I'm here today. I have my own lived experience, and then I also support somebody who struggles with suicide. Couple of housekeeping rules for you. So suicide can be a very heavy conversation. So today, most of you in this room, I'm sure, are familiar with talking about suicide. But if at any point you're feeling overwhelmed, I'm going to tell you what I tell my 4-year-old son. Listen to your body. And if you need to go ahead and get out of the room, please do so. I will say this is an introduction to suicide prevention. This is not a crisis intervention training. We do offer those, and we do have those, but this is an introduction to suicide prevention. So with that, we'll go ahead and get started. Okay, suicide is a complex health issue. Despite its complexity, suicide can be prevented. Just like there are warning signs and risk factors for other health crises like cardiac arrest, we can learn the warning signs and risk factors that can help us to prevent people from dying by suicide. As with other health issues, prevention can start early, far in advance of the problem, or prevention can occur closer to the time of the crisis. Time can be a critical and life-saving measure. You're going to hear me say that over and over today. Time is the key. Typically, a life can be saved if you allow time for the person's suicide risk to subside or to get through that period of distress and to get mental health help. To prevent suicide, we need to identify persons who may be suicidal as well as take an active role in connecting them to help before they take action to end their lives. So the purpose of Talk Saves Lives is to provide community leaders and members with a general overview about suicide, who it affects, and what can be done to prevent it. The presentation will cover statistics to give you an idea of the scope of the problem of suicide. We'll review some key research findings, including the risk and protective factors that relate to suicide. The American Foundation for Suicide Prevention is the largest private funder of suicide research globally. And so that's where we're pulling all this information from. And we'll talk about what works and what we can all do to prevent this leading cause of death. So how we talk about suicide matters. Before we get started, I want to go over some terminology that's used when we talk about suicide. It is important to model appropriate language so that we do not perpetuate the stigma of suicide or mental health conditions. So we're going to establish a baseline of shared language on this topic. We avoid using the phrase committed suicide as it can have a negative connotation. Instead, we encourage the phrases died by suicide, ended their life, or killed themselves. I have a loss survivor who I dearly love, who kind of frames it in when she lost her daughter, and the media was reporting about it. They used committed and she said, it made me sick to my stomach because my daughter was not a criminal. My daughter was struggling with mental health issues. This was obviously not the end that we wanted for her, and so it was very hurtful to me. So when I go out into the communities, I talk about, this is a small thing that you can do to help loss survivors, is just change your language, change this small piece of how we talk about suicide. When talking about suicide attempts, we avoid referring to suicide attempts as failed or successful. Not only is it unnecessary, these words imply judgment. Instead, we encourage the use of phrases such as suicide attempt, suicide, death by suicide. Educating the public about suicide is critical for encouraging help seeking, raising awareness of risk in vulnerable populations, and advocating for new interventions and prevention strategies for those at risk. When suicide is talked about safely and accurately, we can help reduce the likelihood of its occurrence. We want to change how society understands mental health and suicide, because when we open up and connect, talk saves lives. So now we're going to talk about the scope of the problem. Suicide is a significant issue that affects individuals, families, and communities worldwide. You all are experts in this room, and I'm sure you're highly aware of the mental health crisis that we're seeing in this nation. Suicide is part of that. And we're going to talk about some statistics that demonstrate the scope of the problem. So it is a global problem. According to the World Health Organization, over 800,000 people die by suicide worldwide each year. While this is the most accurate and reviewed data that we have available, we estimate that those numbers are much higher because suicide is underreported in many countries, including our own. So that works out to a suicide every 40 seconds worldwide. So in the United States, suicide rates are recorded by the Centers for Disease Control and Prevention, and according to the CDC, 45,979 individuals died by suicide in 2020. This is the most recent reviewed data we have. They have come out with the latest report, so AFSP is very careful about, we review everything before we just start pumping everything out for your data. I'm sure all of you are aware these reports from CDC they're complicated, so there's a lot we have to look at when we're reviewing it. So this makes suicide the 12th leading cause of death in our nation. Suicide takes more lives in the US than homicide, war, and natural disasters combined. These numbers are one of many reasons that it's important to talk about suicide like any other cause of death. The more we talk, the less stigmatized the idea that we all face struggles becomes. So for every death by suicide, it's estimated that 25 others attempt. So that's about 1 million Americans a year who survive a suicide attempt. When you think about any loss, it impacts many people in the community. I recently read an article by a lady that works for NAMI, and I thought it was just such a perfect description of suicide. So, a loss of suicide is like a pebble being thrown into a pond. There are ripple effects, and the pond is never the same. So a community is never the same after a suicide loss. And I think that's just such a perfect analogy of what we're talking about when we talk about the effects it has on a community. The loss affects family, friends, coworkers, neighbors, schools, faith communities, first responders, people that help the family. It's estimated the majority of Americans will experience a suicide loss over the course of their lifetime. So let's move on to research. Only in the past several decades have scientists been studying suicide. Research is shedding light on many critical areas, what drives up risk and what that amounts to for effective suicide prevention. And we still have a lot to learn. This section provides an overview of suicide prevention research, key research findings, and future goals in the field. So one of the main questions research is exploring is, why do people take their own lives? Through research, we've learned that there is no single cause for suicide. Suicide most often occurs when several stressors and health issues converge to create an experience of hopelessness and despair. And we'll talk about that more here in a little bit. So research has consistently shown that the large majority of people who die by suicide have a mental health condition at the time of their death. In fact, that statistic is 90% of individuals. It may or may not have been recognized by the person or their loved ones, and it may not have been diagnosed or adequately treated. That said, research has also made clear that mental health conditions cannot be the whole story. The vast majority of people who have these health conditions do not die by suicide, so that's very, very important to highlight. In addition to mental health conditions, there are many other factors that increase risk as well. We've learned that the brains of people who die by suicide differ from those who die from other causes in terms of structure and function, specifically in the areas related to response and impulse control. We've also learned that most people who are suicidal are ambivalent about taking their life. Part of them wants to live, part of them wants to die. You know, we invite people that have lived experience to share their stories. We're very big on safe messaging when you're talking about your story. And I had a volunteer who said, you know, there was a part of me that just wanted to die, but I also wanted to live. And so that is such an interesting thing to think about, is there's a part of, it's almost like the brain is trying to say, hey, something's wrong, and it's trying to help itself, even though it's not really helping itself. This research has informed key strategies in suicide prevention that involve engaging the part of the person that wants to stay alive and helping to create distance from the part of them that wants to die. So time and distance, you're going to hear me say those over and over today. One way we do that is to help the person connect with reasons for living while at the same time decreasing the visibility and presence of things around them that may facilitate their desire to die. One of the many important things we've learned from research is about the perspective of a suicidal person, that a crisis point has been reached. For a suicidal person, the pain seems unbearable, whether it's emotional pain, physical pain, or sometimes both. So we're going to do a quick little exercise. You didn't know you were doing exercises today, did you? I want you to take a minute and think about a time in your life that you experienced the most pain you've ever experienced. For me, that was giving birth to our first child. And I almost named our child after the man that gave me the epidural. Not joking. And so if someone had come into my room and said, hey, can you give me directions to your house? One, I would have screamed, get out. And two, I would not have been able to do that because all I could focus on is the pain that I'm experiencing. So think about a time in your life where you've experienced maybe physical pain and equate that to, this is what people in crisis are going through. It is real pain that they are experiencing. And so it makes ordinary thinking nearly impossible. So for a suicidal person, thinking becomes constricted at the moment of crisis, a state of intense tunnel vision where other options seem unavailable. Someone who considers suicide cannot foresee a time when that unbearable pain will end. Understanding the perspective of the suicidal person has also helped us to learn that suicidal feelings are often temporary. They come on intensely and can sometimes pass in minutes or hours. Keeping people safe and helping them feel supported can get them through those critical moments, time and distance. There's evidence that putting time and distance between an individual who is suicidal and the means to take their life can be a life-saving action. This is why it's so important that when we take steps, we know someone is struggling to help keep them safe. So researchers also helped us determine the key factors that increase the risk for suicide. Risk factors are defined as characteristics or conditions that increase the chance a person may take their life. Risk factors are important to know to understand the big picture of someone who's considering suicide. Just like someone who is at risk for heart disease because of high blood pressure or a history of heart disease in the family, some people are at higher risk for suicide than others. And the main risk factors shown here can be grouped into three categories: You have health factors, historical factors, and environmental factors. These risk factors can converge at different times in life and increase a person's risk for suicidal behavior at particular points in time. We're going to take a closer look at each of these. So the first type of risk factors are health factors, such as biological and psychological medical conditions, the most significant which are mental health conditions. As we said before, most people who die by suicide have an active mental health problem at the time of their death. Depression is the most common mental health condition and the one that is most associated with suicide. Bipolar disorder is also shown to be high risk, although the disorder is less common than depression. Because these conditions put a person at greater risk for suicide, detecting the presence of a mental health condition is critically important. The best way to be sure when you feel concerned or detect a possible change in you or your loved one's mental health is for the person at risk to seek a professional evaluation and effective treatment. Many people may not realize that their distress has actually become a health problem. Providing information about how to access mental health care or a crisis number if their distress is high can be a solid step in helping them connect to the help they need. We'll talk more about this later on in the discussion when we directly address prevention. Mental health conditions are not the only health factors associated with suicide risk. Serious or chronic health conditions can increase risk, especially when the person also has mental health issues. Chronic pain and serious head injuries have been found to increase suicide risk. I have a really good friend who's an optometrist in Northwest Arkansas, and when I started this job, she said, "Can you come in and talk to my staff?" And I thought, sure, but an eye place? Really? She said, "You don't know how many times we have people that'll be in our office and they're in crisis because they've lost their vision, because they've had a dramatic change in their life, and things are converging together." And I just would never have thought of that. So these are important things to think about, like, do we have a chronic health issue that's contributing to this as well? The second type of risk factors include historical factors such as a family history of suicide, a family history of mental health conditions, or past trauma such as sexual abuse or combat stress. Research has also found that a history of childhood abuse can contribute to suicide risk. And while most people who attempt suicide do not go on to die by suicide, previous suicide attempts are also considered historical risk factors for suicide and also put a person at increased risk. My loss survivors are actually at a higher risk for suicide. So that's something I really think about when I'm interacting and talking to our loss survivors. They're actually at increased risk as well. The third type of risk factors are environmental factors that involve the circumstances of a person's life. Often there are aspects of a person's environment that can contribute to the overall level of risk. So we're going to look at a few. Having access to a way of killing oneself is referred to as access to lethal means. This includes having access to a variety of things such as firearms, drugs, a bridge, a car, and the list kind of goes on. Research has shown that contagion, the exposure to another person's suicide, or graphic or sensationalized accounts of suicide, especially among those with other risk factors, can increase a person's risk of suicide. Prolonged stress may include harassment, bullying, relationship problems, legal problems, and unemployment. Stressful life events, which vary across the lifespan, include experiences like divorce, legal problems, or job loss. To better understand suicide risk, here's an example of a set of risk factors that could converge in a person who is suicidal. So this example shows what is often the public perception of suicide. When someone dies by suicide, often the story that's talked about is the environmental factors. People see a life event like a breakup or bullying or a job loss, and then they see the person die by suicide, so they might assume the person killed themselves because of that stressful life event. But what we're finding is that's never the full story. What others don't know is that the person who died may have had genetic risk factors for suicide. Maybe they were suffering from depression or anxiety disorders, and their work life had become stressful. Their underlying depression and anxiety could have made the situation at work even worse, or perhaps they'd also been drinking more than normal. The key here is that the combination of risk factors could have contributed to the suicide death. Therefore, while a life event can play a precipitating role for suicidal behavior, without other underlying risk factors, life events alone aren't thought to cause suicide. So looking to the future, research will help us find the best ways to fight suicide. Research is currently looking for biomarkers, for example, something testable in a blood sample that would help us to identify those at risk. A number of clinical treatments, like particular types of therapy, are effective for suicidal people, and more need to be developed and studied. The good news is, though, that through research, we're learning more and more about what helps those who are in a suicidal crisis. Research can also help us to identify the most effective programs and interventions to reduce suicide rates and to reduce risk in those suffering from mental health conditions. Okay, so we're going to move on to prevention. So just like there are risk factors that can increase a person's risk for suicide, there are also protective factors that can lower a person's risk. If you are proactive about mental health and make an effort to get healthier, you protect yourself. And we'll talk about this a little bit deeper in a moment. Feeling connected to family and community support can protect against suicide. When someone's struggling with depression, anxiety, psychosis, or substance abuse, these protective factors that may normally be strong can erode and temporarily weaken. When that happens, having friends and family to remind us our strengths can be a tremendous protective factor. Problem-solving skills also help. Life can get really tough at times, but being able to see a way through one's problems can be a protective factor. Cultural and religious beliefs that encourage connecting and help-seeking, discourage suicidal behavior, or create a strong sense of purpose can also be a protective factor. Because mental health care is so important for preventing suicide, we're going to focus on this topic for the next few minutes. Getting effective treatment for mental health conditions like depression or anxiety can prevent suicide. And I'm sure all of you are very aware of this in this room. Critical to suicide prevention is getting people connected to mental health treatment. One of the biggest challenges in fighting suicide is getting people to address their mental health in the same way they would for physical health. In fact, of those suffering from a mental health condition, less than half seek treatment. One way to encourage individuals to seek help for their mental health conditions is to treat mental health like any other aspect of our health. There are certain times when a person becomes ill, and it's critical to seek a trained professional. What I like to tell people is, if you had a broken arm, you would go to the doctor and get that fixed. So if our brains are broken or not okay, we need to go to the doctor and get that fixed. We need a culture where everyone knows it's smart to take care of our mental health. Taking care of our mental health is just as important as taking care of physical health. Seeing a mental health professional is a sign of strength, and many are taking that step. The person seeking help should request a thorough evaluation to figure out if there's a mental health condition affecting their life. There are many types of treatment available, like various kinds of psychotherapy and medications. Research has shown that for many people, the combination of psychotherapy and medications tend to be the most helpful. But the most important thing is to find the treatment that works best for the individual. So, we get approached a lot by different groups, companies, mental health organizations that are like, we've got the solve. Here's the solve. And I say, I love it. But we're not going to promote that one thing. We're going to promote all things, because the most important thing is for the person to seek out help and to find the treatment that's going to work best for that individual. The good news is that advocacy efforts are improving access to mental health services so that people can get the treatment they need. The law now requires insurance plans to cover mental health services on par with physical health services. If we need mental health services, and 1 out of 4 of us will at some point, we should get treated and get our health back on track. Pop quiz. Oh, you didn't know you were being quizzed today either. Anybody know what this law is? It's federal. Oh my gosh, I love the thinking that's happening right now. Yes, Mental Health Parity Act. We basically have no negative consequence for insurance companies to follow through on this, so it's not happening, which is part of my job as an advocate and speaking to legislators is we need to enact this and we need to hold insurance companies accountable. You can, afterwards, I'll give you a lifesaver for getting that right. I like it. Just like people can find strategies that optimize their physical health, people can do the same for their mental health. In addition to professional mental health care, proactive self-care strategies like good sleep habits, exercise, nutrition, and stress management can also play a critical role in protecting mental health and promoting resilience. Prevention efforts also include support for those touched by suicide. The loss of one person to suicide profoundly impacts many. Remember, we talked about that stone in a pond, and you've got layers that happen. It's important that survivors have the support they need, both to heal and to reduce their own suicide risk. And since those with lived experience, those who have attempted suicide or who have experienced suicidal thinking, are at increased risk, we need to make sure that they have the support they need to. For people who are at a crisis point, the most important thing you can put between a suicidal person and their way of ending their life is time. Look, see, I told you, it's going to be over and over. Research shows that by temporarily reducing a suicidal person's access to lethal means, we give suicidal individuals time for their intense suicidal risk to diminish, and time for someone to intervene with mental health support and resources. For the majority of people who experience a suicidal crisis, if unable to access their chosen method, even temporarily, they're unlikely to engage in another action to end their lives. That's a really important clue that we've found through our research. So in most cases, when a suicidal person doesn't have current access to the means that has been on their mind, they don't substitute it with another method. And therefore, a clear way to prevent suicide is to limit access to lethal means. So I'm sure you all are aware of safety plans, making a space safe. We talk about this with individuals. Remove lethal means from the home, whatever that needs to look like. During a period of high risk, the safer their environment is, the better chance a suicidal person has of living through that crisis period. Suicide prevention research has looked at a number of ways to create safer environments. So one way is installing an inexpensive carbon monoxide sensor that would automatically shut off cars if carbon monoxide levels reach unsafe levels. We've learned through research, it was actually one study that was done in a community, that installing barriers on bridges deters suicide, and in most cases, bridge barriers actually lowered the suicide rate for the entire region. So this was a community that was seeing high levels of suicide, and they went in and did one bridge barrier on one bridge in this community, and they saw a 50% decrease in suicides. Why? I don't know, but that is what our research has shown. So that is one effective way that we know of decreasing suicides.
Describe what kind of barriers, like do our bridges are made?
Yes, like those big, tall barriers. Yes, ma'am. Yeah. So restricting access to potentially lethal medications reduces suicide and can be as simple as requiring lethal drugs to be sold in blister packaging. How many of you have ever had to do the blister? It's so annoying. But think about that. That slows somebody down if that's the means that's been on their mind. Firearm safety is critical to reducing suicide rates. In the United States, firearms are used in roughly half of all suicides, making suicide prevention an important part of gun safety education. Does anybody know how many firearm deaths, suicide deaths by firearm here in the state of Arkansas? No one? That's okay. 62%, over 62%. We're higher than the national average. So this is something that it's a very sensitive conversation here in our state, but it's something we absolutely have to start talking about. because it is a huge portion of our suicides here in our state. So as noted already, and contrary to what you may think, when access to lethal means are limited, most people who are suicidal do not find other means. Therefore, the suicide death does not occur in that moment, allowing more time for the person in crisis to get connected to help. Okay, so now that we reviewed key suicide prevention efforts, let's talk about what we can all do to help prevent suicide. It's important to have a caring, supportive conversation with someone you might be worried about to allow them to share what they are experiencing. A conversation is a way to show you care and allows you to gain more information about their level of distress. So we're going to start by talking about suicide warning signs. Watch for the warning signs in yourself and others. While many of the suicide risk factors we discuss endure over a longer period of time, warning signs are observable signs that signal suicidal risk is in the near future. It is important to pay attention to both the risk factors discussed earlier and the warning signs we are talking about now. If you see warning signs, reach out to individuals in your life you're concerned about and reach out to others if you're struggling. Seek mental health services if you are depressed or if your anxiety regularly interferes with your daily life, and encourage others to do the same. Something my therapist told me a few months ago that, I don't know why, it just resonated with me about anxiety, because I was like, I have anxiety. He was like, right, we all have anxiety. And he was like, anxiety, when it becomes and interferes with your day-to-day life, that's when we need to start having a conversation about it. And it kind of blew my mind, because I thought just having anxiety was bad, and he was like, no, it's part of our evolutionary process of, danger, we'll look out for that. But it's when it starts interfering with your daily life that it really needs to be addressed. Suicide warning signs are typically displayed in three main ways. We can detect talk, behavior, and mood. We'll also discuss each one of these in more detail. So many people who are suicidal talk about ending their lives. This may be directly or kind of indirectly. A person might say it outright, or they might joke about it. And we tell everyone, take it seriously. Whether it comes off as a joke or it's direct, take it seriously. Some people say they have no reason to live. Others say things that let you know that they may feel trapped or that they're a burden to others. That's a big one that we hear. Or they might talk about feeling overwhelmed or being in unbearable pain. So those are good indications that this person might be struggling. Behaviors that are atypical for an individual should also encourage you to speak to the person about what you're noticing. People thinking about suicide can display certain behaviors. There may be an increased use of alcohol or drugs. They may have trouble sleeping, either experiencing insomnia or sleeping too much. They may start acting more reckless. They might withdraw from activities, especially from activities they normally enjoy. They might isolate themselves from family and friends. They also might look for a way to kill themselves, such as searching online for methods or shopping for a firearm. They may also give away all their possessions or show a related behavior like reckless spending. I had gone, this was, probably a year ago, gone out to lunch with my best friend, and we're just, two women chatting, and she starts saying, I'm really kind of worried about my husband. He's just acting weird. And I was like, okay, well, what's weird, So she starts going through the different things that he's doing. He's sleeping a lot, and my brain does a check. He's isolating himself. He's not talking to the family. When he comes home, he goes straight to his bedroom. My brain does another check. So she's going through all these different things, and I'm just check mark, check mark, check mark down my brain. And so I just said, you know what, sounds to me like it might be a really good idea, if you can, to get him either into his primary care physician and get him assessed, because these are kind of abnormal behaviors, especially if you're noticing them and you're saying hey, this isn't normal for him. Thankfully, he did go see primary care. He did get connected to a mental health specialist. He was diagnosed with depression, and he got on medication. So I'm happy to report that's a happy story ending. But once you know these behaviors, when you're talking to people, it starts becoming kind of a checkbox in your head. And I would say if you even have 2 of those markers, then you need to start asking about, have they seen their primary care physician in a while? Do they have a counselor or a therapist? Start directing them towards assessment. And I know you all are very, very aware of that, but that's what we tell people in the community is you want to get that person assessed. People at risk for suicide can display often quite subtly any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, anxiety. Moods one would expect of someone who feels overwhelmed and desperate. We all have ups and downs in our mood, but when you notice a change that seems uncharacteristic or concerning, it's important to speak to the person about what you're noticing. So that's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume you're the only one who's going to reach out. In too many instances, people talked about their concern for someone amongst themselves, but hesitated to reach out to the person directly. So here's a rule of thumb. If you're wondering if someone is depressed or overly anxious, you should reach out. Same goes for you. If you're having suicidal thoughts, that's a sure sign you need to seek help. If you've reached out before, reach out again. The first time the person may not be receptive, keep trying. Try talking to someone else or with a professional. And even if suicide turns out not to be a concern, they may still be in distress and they may feel comforted and supported just by knowing you care and are taking the time to listen. So how do you reach out to someone? Talk to them in private, listen to their story, express concern and caring, ask directly about suicidal thoughts. That's a big one. A lot of people, when we talk to them, they'll say, "Are you thinking of harming yourself?" And all of you in this room know that means 20 different things. So we tell people, you want to ask directly, are you thinking of ending your life? Another one that I personally like and have used is, what you're experiencing right now, other people have experienced, and it seems like it's a lot. Like, that's a lot that you're going through right now. Are you thinking about killing yourself? And just asking directly. And we tell people, practice, because it is kind of uncomfortable to ask somebody. The first time I had to do it was with a family member, and it was over the phone. And I remember it was so awkward. It was so awkward for me, but man, I just knew, I was like, I have to ask this because this person had already, attempted previously, and I needed to ask so I could make sure to get them help if they needed it. Encourage them to seek mental health services. If in crisis, take them to help. And we'll talk about it in a minute. You all are probably aware, but we'll talk about 988 here in a little bit. There's some things to avoid when talking with someone who may be suffering from depression or anxiety. Avoid minimizing their feelings. Those of us who've never experienced major depression literally cannot imagine what it feels like. So I drove down from Northwest Arkansas, and I'm a big Tom Petty fan. And I kind of giggle because one of his songs came on, and it's "You Don't Know How I Feel." And I was like, yeah, that tracks. That's exactly kind of what someone in crisis, you don't know how I feel or what I'm experiencing. So keeping that in mind. Avoid trying to convince them that life is worth living. If a person's nearing a crisis point, they're not thinking clearly. Philosophical debates about life being worth living tend not to be helpful or received well. Avoid advice to fix it. If the person's having a heart attack, you wouldn't tell them, you should probably start exercising and dieting and just get healthier. So if they're in crisis, what they need is to be heard and then led to help. Listen to their story, offer to help them find a health professional, help them take active steps towards keeping their environment safe. That's a lot of what we'll talk about with people is, if you have someone that's in crisis that you're aware of, start making the environment safe. Remove lethal means. If you have a safe, a gun storage safe, change the code where only you know the code. Remove medications. And this is which you all are perfectly aware of this is a conversation with that person. You're coming up with this plan with that person, not enforcing this on people. If you think that they might make an attempt on their life soon, Stay with them. Do not leave them alone. Remember, we've got that crisis point, and we know that it is temporary. However, if the situation puts your own safety at risk, leave the area immediately and call 911. Help them remove lethal means or remove themselves from the potentially dangerous area, and escort them to mental health services or an emergency room. I had a parent call me a while back, and he was just asking for resources. And his son had been struggling with suicidal ideation, and stepdaughter, 16, had come in the house, and the son was at a crisis point and had lethal means in his hands. And knowing nothing, this 16-year-old says, why don't we go for a drive and just talk? And gets him to put lethal means down, get in the car, and drive around for an hour until he was able to, till crisis was able to subside. I told that father on the phone, I said, I'm blown away. She did literally everything that we tell people to do, time, distance. You're trying to create that space so that the crisis can subside. So I was incredibly impressed by just her ability to go, let's get you out of this situation. Help them call the lifeline or call the lifeline yourself. So if you don't know, you absolutely should. 988 is a new national suicide hotline. This changed last July, and we've been doing a lot of work as an organization just making people aware. So nothing about the lifeline changed except we shortened it. There's a ton of misinformation about 988 on the internet. Shocker that there would be misinformation on the internet. But we just shortened the number because, and it all goes back to what we're talking about here, everyone can remember 911. Nobody could remember that 1-800 number, and you're asking people who cannot think with the logical side of their brains to remember this super long number. So 988 is the new number, and there is a text with that as well, and it's live. It works. So please let people know that. If you don't hear anything from me today, please hear that. Use 988. I've got cards, all the things. Okay. But if it's an emergency, and I've actually gotten this question from some of our behavioral health hospitals, they're like, when do you call 988? When do you call 911? If it's a medical emergency, it's 911. If it is an attempt in process, it is 911. If it is someone who is in crisis, a mental health crisis, it's 988, okay? Together we can create a culture that's smart about mental health, will save lives, and vastly improve the lives of many more. It's simple yet powerful idea. Talk saves lives. By caring and reaching out, we can all play a part in suicide prevention. We would like your feedback. So I do this at the end of every presentation. You can scan that QR code and you can complete a survey for me and say, this was super boring, or I loved every minute of this, whatever. But one thing I love about AFSP is that we're really big about, we want to hear from communities on our presentations and how to improve them. And I'll give you a great example of this. So we have several modules of this presentation, one being our Spanish version of it. So basically we took this presentation and just translated it. And our Latinx community came to us and said, hey, you're doing this wrong. And we were like, oh, okay, cool. So we completely redid it because this module does not address community and how a community approaches suicide. And we had completely negated that within the Latinx community. So we've changed that, and we now have a new module that includes that community thought process around suicide as well. So please fill this out for me. You can learn more at afsp.org. You were asking about the barriers. We have a whole part of our website. I will say this, and this is going to sound so braggy. I don't mean it braggy, y'all, but I just love it. Our website's actually used by a lot of universities for their death and dying classes. There's a ton of information on our website, so please go to afsp.org and look at that. If you are somebody like me that's a huge nerd and loves research, there's a whole section on the research we're doing. We've got videos that you can watch, about 2 minutes long. We have research documents you can read. Those get a little bit hairy and long, but we have all of that information for you to look at as well. So please take a look at us and see all the things we're doing. And follow us on our social media platforms as well. And I'm going to do a shameless plug if I have time. Where am I time-wise? Oh, okay, look here. Shameless plug. So we do an event called Out of the Darkness Walks. And these walks happen all over the nation. And the idea behind it is to bring the conversation of suicide out of the darkness. And we do one here in Little Rock. It's the largest walk we do here in the state. We do 6 across the state. Love for you to participate with us. Also would love for any companies to sponsor this event as well. And Sharon Ledbetter in the back, who is one of my lovely volunteers, has flyers for our Arkansas Hike for Hope that's happening on May 20th, and then also the River Valley Out of the Darkness Walk. So please check us out. Please be a part of what we're doing here in the state. And that's all I have. Yeah. Do you want to do questions?
I was going to ask.
Yeah. Please, I'm going to leave that up there.
62% of the firearms suicidal, is that higher amongst men?
Yes.
I had read somewhere where men pick the more violent method of suicide, such as a gunshot wound.
Correct, yeah. So
Okay, I was wondering.
suicide is highest among men, period. Yeah.
Okay.
And some of that, I think, is the stigma around getting help. The number of women I've talked to recently, and this is like, take this with a grain of salt. This is me, it's just me as a person experiencing this. But the number of women I've talked to that their husbands post-COVID are like really struggling with depression, but it's coming out in weird ways, is quite a lot. It's quite a lot. And their unwillingness to get help. I've had several girlfriends that have said, he's not okay, we've acknowledged that, but like one of them said, if I go get help, then it's real. And I thought, that's a very interesting way to look at that. I mean, it's already real, but that's the thought process, is if I go to a mental health professional, it's now real. So, yeah, great question. Other questions? Yes, ma'am.
When you say post-COVID, do you mean post the pandemic or post having COVID?
Whatever world we're in right now. I mean, can we say post-COVID at this point?
Well, I'm talking about like, did they have COVID and then have depression, or was it post that period?
I don't know the answer if they've had COVID. It's just post the period of like, we were all trapped in our homes and the anxiety. And several of those men had jobs where they had to still go in and take care of employees. And so again, grain of salt. I think some of this is ripple effects that we're going to see from COVID. I mean, I think there's right now out there that we're not going to see the full effects until 2025. But I think it's one of those things where we were such high anxiety, and now we're not so much high anxiety, but we're still, it still affected us. But we were unwilling to see how it was affecting us in the midst of it. Does that make sense?
It does. I'm just finding in my little sample of my practice that a lot of the people who had COVID and had a
Serious case of it, yeah.
they're struggling with depression.
Fascinating. And
So I don't know if that's because of like the brain fog and stuff that a lot of them like having that long COVID experience,
right.
but it's pretty.
I think COVID is going to be something we're going to be studying for years to come. And the effects of it. What does long COVID actually look like? How it's presented in different ways in different patients. Yeah, very interesting.
So I guess kind of piggyback on
Please.
what she said about this. You mentioned that there are structural changes within the brain, right? And so the way the brain functions, and changing the neural synapses, and so that you don't get tunnel vision onto this, right? That you
Right.
get outside of that.
So I have a volunteer that I recently met. She's a loss survivor, lost her dad and her brother within about 4 months of each other. And then she herself is an attempt survivor. And she's really big on like the neuroplasticity of reframing the brain. And I can't remember, there's some incredible doctor that does this work that teaches that, but she's really big on remapping the brain. So that's one absolutely that we're looking at is, are there ways that you can kind of like retrain your brain?
And is this through like psychedelic type drugs? No, this is through.
What you're doing, therapy, yeah. All through therapy, yes. But the problem is, how do we get them to you? To get them to start doing that. That's the problem. And cost, correct. Mental Health Parity Act. But yeah, that's a great question. Any other questions, comments? Yeah, no, you're fine. Please.
Interesting and helpful.
Good.
Okay, this is a problem, and I'm sure it's been looked at as these people who want to commit suicide and go out and do the school shootings and kill people along with them. Additional, they're killing others and they kill themselves on purpose, intentional plan. What, I don't know, is it considered suicide or what is that? I mean, are they looking at that or trying to treat? I don't know, it's hard because it's so spontaneous maybe.
Yeah. Well, did anybody watch the interview with the most recent Kentucky bank shooting, the parents? Fascinating. That is a great interview to watch. As mental health professionals, it's very good to watch. But the parents of that young man came out and they interviewed at Good Morning America, which is rare. We don't see that very often. And they said he had everything. He had all the mental health help. He had a therapist, he had a specialist, he was on medication. We knew all the warning signs. We knew everything. One thing they didn't know is that he bought a gun 5 days prior to the event. And we're completely unaware of that. He was at a family function the day before, acting totally normal. So some of that's hard. It's hard. And there is a small portion of us that we do say, like, suicide is preventable. And most of the time people show warning signs. But there are the rare few that don't. I will say that interview, I did get teary because at the end, the father was like, he said, this is awful, but I went from praying for his safety to praying that he would kill himself and not hurt anybody else. And so ultimately what you're talking about is you are talking about somebody that's suicidal. You're talking about somebody that's in crisis. So I think the key here, though, is like leading up to it, were there things that we could have noticed that would have affected change? I kind of wonder if the roommate, and you'll see it if you watch the interview, the roommate's the one that sounded the alarm that day of like, hey, Mom, this is going on with your son. I wonder if we were seeing more, had we been trained on what to look for, could we have stopped that? So, yeah, I mean, it's a fair, and it's a question we're getting more and more, unfortunately, and I'm very tired of seeing it.
What's the name? Kentucky.
It was the Kentucky bank.
He's an employee.
He was employee, yes. Yes. I thought it was on ABC, Good Morning America, because it was, I love her. I can't think of her name, y'all. Thank you, Today Show. I was like, I can't, my brain, thank you. It's pregnancy fog, it's fine. Okay. Any other questions about Talk Saves Lives, anything I covered, AFSP, any of that?
Are we able to get a copy of the PowerPoint?
You can't, and I'm so sorry because like it's our thing that we own. So I was like in that one and that beautiful packet she had, and I was like, oh, y'all aren't gonna get that. I'm sorry. Yes, Mia.
Just as a question, and based
for help. I'm noticing it like more in the spring and then like October, November, where I'm doing a lot more suicide assessments, and I'm just curious if like through the 988 or other,
Yes.
you're seeing similar.
Yes. We saw an increase in calls when it switched over from 988 within the first 2 months. And that runs through our Arkansas Department of Health here in our state. We've got a couple other crisis call centers as well, but we have seen an increase. So winter and then nighttime. So really from like 5 p.m. to like 4 a.m. is when the highest risk happens. Yeah. So yeah, absolutely. And I think some of it is, like we talk about, not winter blues. I'm thinking about my own experience where people were like, oh, it's baby blues. It's just baby blues. But it's not just baby blues. And the same thing like seasonal affective disorder. Yeah. So, okay, yeah, maybe. You can't get outside as much or you don't love being in the cold. But it's when it goes past that like we need to call a spade on that. That makes sense.
Yeah, I think they did a study in Alaska because it was so dark many months.
Mm-hmm.
There was a higher rate of depression. I think it goes that study, and that was interesting.
Yeah, I mean, we talk about, and I'm happy to send them to anybody that is interested in seeing them, but we do a program called Research Connections. So we take our AFSP funded researchers and we ask them to do a presentation for our Arkansas community. So it's free for everybody to watch and be a part of so that they can share, okay, you walked, you raised money, and this is how it's applying. And so we've had 2 in the last year. One did she's doing a study on sleep and its impacts on suicide. Fascinating. I also learned that you can stop nightmares. I didn't know that, so it was really good to just learn as a parent. And then the other thing that we had, another lady came in and she spoke about contagion. So we mentioned contagion briefly in this presentation, but she goes into communities and really studies why does contagion happen, which is when you see multiple suicides in one community. And so her and her team are identifying what are some of the common factors these communities have in common. What was interesting was she said it's the close-knit ones. They're the highest risk for it because they're talking about it, but they're not actually talking about it, which was fascinating to me to learn. So if you're interested in listening to those, I'm happy to send you links because we recorded both of those. But again, afsp.org, tons of information. Stuff about it. Like if you're a parent and you have a child and you're concerned, if you're a mental health professional, all the things on that website. Great question.
Contagion, right? So there was a study in Europe several years ago that looked at if you put in a newspaper, it was front page and someone committed suicide, the rate of suicide skyrocketed.
Correct.
If you moved it off of the front page, back later on, or back
Correct.
in the newspaper, it did not have the same effect.
Yeah.
So I'm just curious, two questions on this. One,
Sure.
Are you doing anything in the schools?
Yeah. Yes.
Right. And then how do you, what do you do for social media?
Yep. That's also a great question.
Right?
Yep.
Because they don't read newspapers, right?
Right. Right.
Right.
So if you can't, you're absolutely right. If you can't get a prevention technology of some sort or some type of adjunct through an app or through the phone, through social media, whatever,
Yeah.
I think we're going to be struggling with this with our kids for a long, long time.
Yes. Well, to quote my very lovely volunteer that's in the back, she would tell everybody to get rid of it, social media. But I'll say this. We're researching that. We actually have a couple different studies that are happening right now. We had one of the researchers come in. She's specifically looking at girls and the impact of social media and the correlation with suicide on girls, adolescents. So, a lot of people are like, it's social media. But social media can actually be a protective factor. So it's not so like cut and dry, black and white. Yes, we go into the schools. So there are a couple things. We provide suicide prevention education for free to schools. We train teachers. Anybody know what the requirement for teachers is by the state for suicide prevention? Anybody? Like, look at them, like Sharon. Every 4 years, teachers are required to get suicide prevention training, teen suicide prevention training. It's typically about 2 hours. It's a video that they watch.
But the 2023-24 school year, the Department of Education is requiring all school districts to have a mental health awareness week.
Yes. And I think, correct me if I'm wrong, several of them now have to have a mental health specialist on site.
Yes.
Is that the term we're using? Anyway, yes. So good move. We're heading in the correct direction. But a lot of the times when I go into schools and we train the teachers, they're like, this is the best suicide prevention training we've had, because I'm not looking at a screen and I can ask you questions and you're a person, you're a whole person. So we start at 2nd grade with Gizmo's Possum Mental Health Guide. You're welcome to come look at it. It's adorable. It's basically a watered-down safety plan that elementary kids take home and they do with their parents or guardians. So that's a great one. We talked to schools about, and I was just talking to one of the ABHIN employees. She's doing a grant, postvention. A lot of communities here are like, postvention? Why would you do postvention? Well, postvention is prevention. All of it kind of goes together. So we'll go to schools and say, hey, if you have a suicide in your school, what do you do? You'd be amazed at the number of schools that go, I don't know. So AFSP, along with several other highly decorated organizations, including the American Academy of Pediatrics, created a model for school district policy. It is free. It looks like this. I think someone took my display copy, which is fine. That's okay. Take it, use it, please. But it literally goes through everything. It walks you through everything. What happens if it happens at school? Who are the people that need to be involved? What policy do you have around this? And it walks them through everything that they need to be considering as a school district. The other tool that we use is After a Suicide Toolkit. So this is how you respond as a school if you do have a suicide loss. And there's a lot of confusion on how to respond. A lot of times schools won't do anything. They won't talk about it, and that actually puts kiddos at higher risk. So there's that. Social media. You asked about social media and newspapers. So we actually have a whole section to us where, like, if I have a journalist that reaches out to me and says, hey, I want to interview on a podcast, I'm like, great, go review our terms for journalists. Because the way we report about suicide, how we report about suicide, actually can put people at greater risk, which is a great example of putting in the front page, can actually put people at greater risk. The questions you ask. I had somebody ask me once on a podcast. I told him, I will not answer that. He still asked me. A lot of skeptics out there say if someone's just going to kill themselves, they're going to kill themselves. So what do you say to that? I was like, this is not helpful. So the way we report about suicide is really critical. And we have a whole other toolkit that we give to media outlets. Please consider these things. Train yourself on how to report about suicide. And I actually had someone come to me and say, I've been reporting about this wrong. And I recognize that. I've been putting lethal means. We don't talk about lethal means. You will never hear me say, this is how that person died. Because no, it doesn't give ideas. It puts people at greater risk. And it traumatizes you. Like if I'm a loss survivor and I lost somebody to suicide and they died and they used a firearm, and you're explicitly talking about that, that can trigger me. So we want to make sure that we're being safe in our messaging as well. We use social media to kind of turn the table on that. So if you follow us on social media, you'll see a lot of our stuff there's 2 campaigns that we have that are incredible. I love them. One is Seize the Awkward. I know, it sounds weird, but it's an excellent campaign. And basically it's geared towards adolescents, youth, and walking them through the importance of seizing the awkward. If you go to seizetheawkward.org, there are a ton of videos of like all the people that they look up to. Billie Eilish is on there. There's all these like famous people talking about the importance of asking the question, are you okay? And it has tips and tricks, and it's flashy. It gets the attention of children, very much so. I mean, teenagers. And the Ad Council, this was in pairing with AFSP and the Ad Council and the JED Foundation to have this going. And we have lots of commercials that sometimes play too that you'll see. You've seen it. Somebody said they saw it. It's a great commercial. It made me cry, but it's fine. And then the other one that we have is Real Convo. So that's another one that we put out. It's a great marketing campaign, and then we do a ton of stuff with social media to put that out. And so kind of what I tell people is think about for a minute, at least this is me, I'm scrolling on Instagram, I'm seeing, all the perfectly beautiful pictures of people on their beach vacation or whatever, and then I see it's okay to not be okay graphic. Or I see check on the people who are strong in your life. Like different things like that, different messaging. So we're finding ways to use social media as a protective factor. And I think that's going to be a good avenue that we'll head in going forward. Did I answer everything for you? Okay, cool. Just to make sure. Please get some of these. Please take them. They're also accessible to you guys. You can buy them and have them in your offices or wherever you work. You can keep them. So yes, sir.
Are there any resources for clinicians, therapists who talk about the Louisville,
Yes.
They said we did everything right.
Yep.
Therapists. Well, there's a therapist there, there's possibly a psychiatrist there. So when, and everybody in the room who treats somebody knows you do everything right, still something that happens. And so then the clinician, the therapist could feel not only the loss of the patient, but also a professional loss.
Yes.
Are the resources for that?
Which is a great question. So yes, and that is something a lot of therapists that interact with us, that's what they're connected to us with, is they lost a patient. And so there's that personal effect, but then it's, yes, and the professional guilt as well. Again, and that goes back to that pebble in the pond. You're one of those ripple effects. You are one of those things that has been affected by that. So, yes.
That's a very lonely feeling because you
Yes.
can't talk about that. You can't go to your loved ones and say, I knew that person. I experienced this.
Right, because of your,
I'm experiencing this because you have, because of HIPAA, because of confidentiality. You can't go to your usual source of support and explore that with them and allow them to help you through that guilt or that grief process, I should say.
Yeah. So yes is the answer to that question. We've got Healing Conversations, which is a program that you can reach out and request a phone call. We've got our Survivor Day events that we do. So this is the Saturday before Thanksgiving. Every year, annually, it happens internationally. And the conversation is around identifying this is a loss, this is grief that I have, educating on the grief process, because it looks different for everybody. It's going to look different for you than it is for someone that lost their spouse. But absolutely participate in those things. Our walks, we have tons of people that participate in the walks that are mental health therapists that have lost patients, and they find connection that way. And I'm going to say this to address you, and this is, again, this is me not knowing your policy or anything like that, but really all my best friends are counselors, which I don't know what that says about me, but anyway, and I would encourage you to talk to another mental health therapist.
You usually have coworkers, you have that
Yes.
connection with other people.
Yes.
But it is different. You have to rely on other sources than what you would normally rely
Right.
on. For such a personal kind of feeling.
Oh, yeah. And she always says, which I use now in my work, I've kind of trained my coworkers to do this too. But to walk up to your person, whoever it is at your job, at your clinic, and say, do you have capacity for me to talk to you about something that just happened? And if they say no, okay, we don't have capacity. But if they say yes, then can you help bear this load with me? Because it's when we experience that I think gets kind of scary. Same thing for my lived experience, postpartum. I don't know how many of you know this, but suicide is actually one of the leading causes of death for women postpartum. We launched a maternal mental health hotline in May of last year because it is such a rising problem. Since 2018, we've seen it triple. And it's very silent, and there's 2 reasons for that. It's stigmatized, suicide is stigmatized, but then it's stigmatized almost doubly, in my opinion, because most women that you talk to or you share with, which was my experience, this is the happiest time of your life. What's wrong with you? But we're not going to talk about all the other factors that are associated with that. So it's when I hear people say it's very lonely, that to me is like we need to invite community into that space, for sure. So yeah. Okay. Yes, it is. Yes, it is. Maternal Mental Health Awareness Month. It's very real. And May is Mental Health Month. So check us out. We're going to have a whole bunch of stuff that we post. But yeah, if you have any further questions afterwards, come find me. You can talk to me. And please come get stuff and take it with you. Thank you.